Hi there, Mel here from Synthesis Health Lab, and welcome to this somewhat impromptu live. I hope you're doing well wherever this finds you. The reason why I wanted to kind of come on here and share a little bit is because yesterday I made a post on Facebook. Sometimes if I'm seeing patients and I notice a pattern or I think of something that I think might be helpful, I'll share it. And so the post I made yesterday was about how there's actually no correlation between having digestive symptoms and having gut inflammation, which means that you might be someone who doesn't have any digestive symptoms or digestive complaints. You poop every day. It's fine. It's not traumatic. You're not bloated. You don't have a lot of food sensitivities, which would very reasonably give you the impression that you don't have any digestive issues. And I don't like to be alarmist or like kind of give people problems, but the fact is that you could very well. I'm not saying you do, but you could very well still have gut inflammation, which is very very common, especially if you have other symptoms that might not be digestive. So for example, maybe you have joint pain or you have brain fog or you have mood issues or you have hormonal issues, then it's possible that you are not actually getting digestive symptoms. And I have to be honest, a few years ago, this idea of leaky gut, where your gut was a bit too permeable, like cheesecloth, and everything was sort of seeping out. In the alternative medicine space, everyone was talking about leaky gut and blaming it for everything and saying that everyone had leaky gut, which annoyed me because it just didn't feel very empirical. It didn't feel very scientific or confirmable. But then once I've been doing lab testing for a long time, and as the lab tests got more and more sensitive for this particular issue, I realized that a lot of people do have gut inflammation and might not realize it. And then the second part of this post is really that, you can look at your tongue and get a lot of information, which is to say, not to say that you get the same exact information from your tongue that you might get from a stool test, but the tongue has certain advantages. So one is that it's free. You can just look at it. So having the knowledge of how to look at your tongue and get meaningful information about what to do it's a really useful skill. You're getting that information every day. So with the stool test, you're not going to run that every day, right? It's hundreds of dollars. So maybe depending on the issue, every 3 months, 6 months, 1 year, right? But the tongue is dynamically changing. And so it's with you. And then the third thing is that it's a different type of information. So your tongue is giving you information about your ecology, which we'll go into in a moment, where the stool test is giving you data, and that can be useful for certain things, but it doesn't tell you your ecology. And I would suggest that I found that people that I work with get much more reliable results if they work with their ecology rather than with this discrete data. So, excuse me. So we can look at that in a moment. And so after I posted this, I had a few questions come in. Would you elaborate on how you're verifying levels of gut inflammation and what the tongue is showing? Which is, why I wanted to make this post, just to help out. And another person asked, Jeanette, would be curious about your observations of lab results for inflamed GI and specific or general tongue patterns. And Joel Spreckman over at Heads Up, which is a really interesting service for like kind of bringing in lots of different information from blood tests and blood sugar and different wearables and kind of getting a dashboard. So he put, that's going to save people a lot of money and unnecessary pain and suffering. Like, yes, this is why I mention it. And years ago, we had the idea of a tongue diagnostic for noobs course, which I will say that on the program that I run for folks who are who are recovering systematically from complex chronic illness, there is a whole advanced module on how to do tongue diagnosis, because you may be a practitioner or you may not be a practitioner. You may be just an individual person who wants to be proactive about their health, and you may have a complex chronic health issue, and you might want to get better from it, right? And the thing is that in Chinese medicine, we do a lot of study on how to look at the tongue and assess it and get really valuable information. about how to then guide treatment. But this is, I would say, an essential life skill, that everyone should really understand this, because it's, as I say, it's accessible and it's useful, and sometimes the information is more relevant. So touch on this briefly. So the first question is, what labs am I using? And also we'll get into why you might not need them. So let's pop over here. So let me just get this clean for you. So the first is this. This is from a stool test, and this is from a patient who did not have any digestive symptoms at all. He had other stuff going on. He had kidney stones. He'd had a heart attack, which may be related to this, but he did not have any digestive symptoms. So the first thing that we can see on the stool test is that he has some giardia there. And I can tell you that that's not supposed to be there. So I'm going to just show you a little bit how to interpret what this is telling us. So when it says 2.69 E2, a little bit of scientific notation, that let's say it said 2.0. Let me just see. No, that's not easy to see. Let's do it better. Okay. If it said 2.0 E2, then that would be 200. It's telling you where to put the decimal place after the first number. So the normal value is 5.00 E3. So the normal value is 5,000. So what they're saying is that if they find giardia in your poop, but they find any fewer than 5,000, then that's normal. Okay, and this is helpful in the sense that they're not just telling you if something's there, they're telling you how much, because we can have things passing through. My interpretation, though, of this particular test for this particular patient was that the 269 giardias that they found in his poop was not normal. That, it's just, it seemed to me that was probably hanging out there for a while, and that it just had no business being there, basically. So I kind of flagged that as a potential issue. The second thing that we saw is that he has a lot of blastocystis hominis, and that's another parasite. And again, there's arguments about whether or not, it's normal to have a little bit of blastocystis hominis. I mean, just bearing in mind that of our 70 trillion cells, over half of them are microbial, right? So, it's normal to have certain stuff hanging out in our ecology. For this one, the normal result at this lab is 2.00 E3. So the normal amount, if they're measuring how many are in your poo, is 2,000. But now look at him. So 1, 6, 8. Now we need to move it over 5 times. So that's 1, 2, 3, 4, 5. So you can see that's way too many. That's way too many. So he's got a lot of blastocystis hominis, and so I see it overgrown in people who just have chronic gut inflammation leading to a certain habitat where this stuff is overgrowing. So to me, having way too many blastocystis hominis is both going to be a cause of gut inflammation and also an effect of gut inflammation. So these markers are not directly telling you about inflammation, but they're telling you about who is in the gut, and are they meant to be there. This next section I think is really valuable. As I say, I rely on lab tests less and less the more I practice, and I like to teach people how to do a lot without them, because a lot of times we just don't need them in order to get really good results. But this test is useful as a kind of gut checkup. And this is off of a lab called GI Map, but there are other labs. Genova has a good test. Vibrant America has a good test. So it's really just making sure that they have, they're using good technology and that sort of thing. So it doesn't have to be just one, but this digestive health thing is really cool. So this first one is telling you, do you have fat in your stool? And if you have fat in your stool and you're not able to digest it and absorb it, then that suggests a gallbladder issue. The next one is elastase, and that's a enzyme that's coming from your pancreas, and their normal result is like anything over 200 micrograms per gram. For me, a healthy person is really doing at least 500. So occasionally I'll see it below 200, and I can tell that person is like kind of really in need of support. But anything below 500, for the most part, usually this is to do with the nervous system not being relaxed enough to trigger healthy digestion. So really, we want to make sure that we're chewing our food and that we are like not eating on the go, we're not fighting, and we're not like, watching awful news while we're eating. And so, kind of, I want to dance a little bit back and forth between lab tests and not lab tests. Like, you don't need a lab test in order to know that you need to chew your food. But some people might find actually having the marker motivating, right? And if that's what it takes to get you to chew your food, because I can, it sounds sort of like trite, but like that's what's going to trigger this to come up, then it's worth the cost of the lab test, if that makes sense. This next one is the beta glucuronidase. That's coming from a certain type of bacteria, and when that gets too high, that can really impair our detoxification. But the ones I want to highlight really here is, let me just come back. First of all, one of my favorite uses of this test is as a screen, because a lot of people are told that they need to get a colonoscopy for no particularly compelling reason. So just because they're over a certain age or something like that, where people are not often informed of the risks of colonoscopy, which there are some, but also that it's invasive. The stuff that they give you to take actually wipes out a lot of your healthy gut bacteria, which is just not a helpful thing for long-term health. So if there's a screen that would let you know whether or not you need a colonoscopy, like, I find that very valuable. And this is validated in the sense that, like, in the UK, they'll use this as a screen for colon cancer and that sort of thing, because it's looking for occult blood. So if there is no occult blood, then the chance that you have colon cancer goes down precipitously. And the other one is calprotectin, which is a marker for inflammation in the gut. So his calprotectin is 4, which is quite low, but that is coming from white blood cells infiltrating in the large intestine. And when that gets elevated, then that can indicate an ongoing inflammatory process in the large intestine. So either cancer or inflammatory bowel disease of some description, or chronic infection or dysbiosis. So we can use the test that way, which I like. I like helping people avoid unnecessary procedures, right? And you might too. But on this test, what tells me that this particular person with 0 digestive symptoms has a gut that's too permeable is this one right here, which is the secretory IgA. And the secretory IgA is the first line of immune defense in the gut, but it's secreted by the gut lining itself. So when we have chronic inflammation that's degrading the gut lining, then it's not able to keep up with producing that. And so we see it low. So if it's high, that's more of like a not an acute inflammatory process, but a robust inflammatory process. And when it's low, it tells us that it's just been going on for a while, and so those cells are unable to keep up. So I'm going to keep kind of rapid going, but feel free to leave any questions or comments in the comment section, and I'll see if I can get to them, just to make sure that this is like at the right level and that it's helpful and interesting. Because if you're a patient, and you could be a practitioner or not, in a sense, like, you don't necessarily need to know all this, but it can be kind of useful to know where things come from, know how your body works. I think is really, really useful. So as I said, this section is directly measuring inflammation in the gut, particularly lower down in the large intestine. So now let's see. So another way that I can tell, and actually I want to back up a little bit about leaky gut, because so, I mentioned before that it's very common to like blame leaky gut for everything. But I want to give a little bit of a distinction, which is that the gut is able to dynamically adjust how leaky it is, just like the pores in our skin. Okay, so we've got little holes all over our skin, and if it's hot, we can open our pores and we can let sweat out. And if it's cold, we can tighten them up, and it's dynamically changing how porous our skin is. And that is actually how the gut works. So it's not that it's leaky or not, it's that it is able to dynamically adjust how selective it is in what comes in or out. And so it can get chronically too leaky, where things from inside the gut are coming out into the bloodstream. Some problems are actually associated with the gut that's not leaky enough. People don't talk about that very much. And that's when the gut has to close down. Again, similarly to a defense process, where things are threatened and it's less permeable. And that means that we're not able to absorb our food as easily. Okay, so remember that it's dynamic. It's not just one thing. It can be too leaky or not leaky enough. But let's look back here at one of the labs. So this is from a blood test, okay? And this particular one is from the Wheat Zoomer that Vibrant America does. Again, sometimes I'll run this really as a patient education thing. Like, I had a good feeling that with this particular patient, even though he had no digestive symptoms, his gut was probably not pristine. And so if I'm going to try to convince him to make certain changes in his lifestyle, it's helpful to have data to back that up. And so what we see, so zonulin, I mentioned just a moment ago that our gut can adjust how leaky it is. And zonulin is one of the ways that it does that. So if we get antibodies to zonulin, then that may be indicating that zonulin is going too high. But the one that's really more important to look at here is anti-LPS. That is telling you about gut leakiness. So in research studies, they actually measure LPS directly to see this. But this is really telling you about leaky gut. So what is LPS? So it stands for lipopolysaccharides. Lipopolysaccharides. And basically, I mentioned a moment ago that you've got 70 trillion cells in your body, and just over half of them are microbial. So we need a way to pretty reliably and accurately tell, like, who is who, what is going on, which cells are which, right? And so lipopolysaccharides are they are, I guess, sugars and fatty sugars that are on the outside of certain types of bacterial cells. Okay, and it is one way that our immune system can very confidently identify that this is bacteria, it is not human, because human cells do not have LPS on the outside. Okay, so this is like a shorthand. And so what can happen is that this is our digestive system. So over here we've got from the front, and over here we've got on the back. Okay, so you eat your food in your mouth, and then it comes down this nice long tube, and it goes into the stomach. All right, and then from the stomach, it's going to go into the small intestine here, where I'm drawing here. Okay, and so the small intestine and to a larger extent, the large intestine are full of bacteria, and that's healthy, and it's actually very important for our health that we have a really good ecology in our digestive tract. And so when it is inside of our digestive tract, here's the thing, anything that's inside of our digestive tract is outside of the circulation. So if it's in the stomach and it's in the small intestine and it's in the large intestine, it's not in our circulation system. Okay, so what can happen is that the bacteria, which may be perfectly fine bacteria to have in a digestive system, if the small intestine becomes too permeable and then it leaks it out into the liver, then it gets into the systemic blood supply, and that is called endotoxemia. So that's poisoning from within, right? And so with this patient that I'm mentioning, who had no digestive symptoms but a heart attack, he had no other risk factors for a heart attack. Okay, he was not overweight, he was active, he didn't smoke, he didn't drink, his diet was fine, so really in terms of what could cause that, well, persistent poisoning from within from your gut is a really, perfectly efficient way to cause atherosclerosis and damage to the circulation system. So if we hop back over here, he had elevated antibodies to the lipopolysaccharides. So those guys are getting in, and his immune system is really busy creating inflammation to try to handle this. And this would be ongoing. So it can spike after certain meals where you get like a transient increase. And so, kind of, again, going back, I can't see all of this on his tongue, but specifically, but I can see things on his tongue, which we'll get into. But that would be a robust lab test for leaky gut. Just thinking a little bit about the strategy about when to order, what to use labs for. So after lipopolysaccharides is 495, someone's